Mwashibukeni kaili mwaiseni kumula basawaya FM kuli program iyo iitwa at Insaka ya Bumi ituletereko na ba Population Media Center ine ishinadianzini nebo chipo na mstudio lelo nshirineka njinda ba Mr. Mwewa
800
Bumi usuma makapa njubachila mano mamulwa.
In the heart of Copperbelt Province, where access to vital information is a challenge for many, there is a lifeline. Insaka ya Bumi.
Let's take a listen to another caller. Insaka ya Bumi on Kokoliko FM. Hello?
A radio call-in show that has brought knowledge and hope to thousands.
Kusha HIV and AIDS abantu tumwa bakosele shanyu kuichingirira kukashisha kaka kwete kushupa sana.
Mukwai inshira shaba ishingi emobengala ichingirira kuti kwaba ukubonthya umupila nangula ama maximum condoms.
On these airwaves, experts share life-saving information about HIV/AIDS, sexual and gender-based violence, maternal and child health and family planning. But it's not just a one-way conversation. It's a dialogue, a connection between the listeners and the experts who understand the struggles.
This is Insaka ya Bumi. That's how interesting it gets sometimes. And there's no such thing as a wrong question or a good question. All questions are valid when everything is taken into account. Let's take a listen to another caller. Insaka ya Bumi on Kokoliko FM. Hello?
Shinalianzi ninebo Theo Makatati na fyali ilwe ku shilila bombwe. There was one time naishi ambo kutika kumulabasa wako koliko. Na isa mfako programu ya Insaka ya Bumi. So balelanda palo wa family planning. Vidafine balelanda family planning mwaya chitakisesa ama service kuchipatala. Family planning ni yisuma ila chingira ko pari nga mlefo kwata ko mlefo kupisha point chitapa kwato mwana nga mwadi upana yo ekapo fili mlefo child space nila fuidisha ko ila bomba. So tuibaba kushalila in terms of information ino station opportunity atufetule kwata okuba aware no kwata information ingi no shalila because twadika ila sana muri misconception ya kweba family planning taibomba family planning ilo na olobu fyashi fyabu fifienefi mwala kwata okusambira pwefing sana ikankala sana i program ine kunate mwe atwalile i program yaba fe konsefe kuma radio station abantu bakwata okumfira pwefingi because i program inaya kuidisha abantu ifingi. I'm one of them and I can testify ninkwato kuishubira pwefingi about family planning na health wise as a young person ninkwato kuishubira pwefingi. So program ikunatemo ya atwadira kwena kunatemo ya konkanya hapo muna mkopa belts even Zambia at large.
The impact of Insaka ya Bumi goes far beyond just transforming individual lives. It's reshaping entire communities, inspiring a new way of thinking and acting. Conversations once held in the shadows are now brought into the light, creating a ripple effect that reaches homes, schools, and clinics. It's not just changing minds, it's changing how care is delivered across the province.
My name is Simon Chirufia. I'm the District Health Promotions Officer, standing in for the District Director of Health for Chingola. I would like to express our gratitude to our partner, Population Media Center, for supporting the activities which are the radio programs that we've been having as a district in the area of HIV, sexual and gender-based violence, family planning, and mental care. However, we have seen that the program was quietly impacted on these four thematic areas of health that I've talked about. Under HIV, we've seen that there is an increase in knowledge levels in our communities about issues to do with HIV as well as people seeking for treatment. When we talk about sexual and gender-based violence, previously, people didn't know where to report some of the gender-based related issues. But however, with the help or the coming on board of Population Media Center into the district, we've seen that people have got knowledge to know where to report issues related to gender-based violence as well as sexual violence. We've seen, especially in the area of mental care, that there is also an increase in male involvement, issues which were seen to be of women, but we've seen that men folk have also come on board to support antenatal-related issues in the district. This can be seen by the number of contributors to the radio programs that we've been having. Usually it has been 50 to 50. 50 men calling, 50 women calling during the antenatal care radio discussion programs that we've been having on various radio programs. And coupled with that, the radio programs have also supplemented other social mobilization and advocacy strategies that we've been using to reach out to the undeserved communities within our district. And for that, we are saying thank you for the gesture that has been shown to Chingola.
Ifwe echo tuloleshapo chakwe bati abantu bakwata ubumi busuma ngefine tulelanda okwe bati insaka ya bumi ero abantu baisakura ku uchipatela atatu balipirisha tubapela fe ama guidelines efyo baringile ukonkana nao uyu umuti.
This is not just a radio show, it's a lifeline, a voice for the voiceless, a source of strength for those facing overwhelming challenges. But more than that, Insaka ya Bumi has brought communities together, breaking the silence on issues that have plagued families for generations.
Mashina yandi nebo Martha Kamanga, chikala Kukitwe West. I came to know of my status in 2009. Since then, I've been on ART. So akale kunumoko nale kwa teach konko tanto mshachitekela tukutina isanga muli status nombecha causing because of my husband. He was a vale tolaika filia, so naishile isanga moshi so nomba nale kala fila fine there kuma clinics ya ma review ndipo komti what type naishile mbo kumfa kuli Insaka ya Bumi. I was encouraged and motivated. Bantu naisaba kwati nabali lift nichiko nakwete kumkosha. Then naisambila kwe fingi sana. Then from that time I've been encouraging my friends konchito. And then imbi point na likwete fi ilian kama kwati I shouldn't share with anyone else apart from my children. So from that time and they were open. They were confident, friends, oh, please status, just accept, and then wamba nomti.
Before Population Media Center came into being, I think we had a challenge in maybe accessing radio programs so that we can educate our people in the district. So the coming on of Population Media Center has helped us also to reach to a lot of people using the local radio stations in our district.
The first entry, ukusenda ARVs nango kutominga senda ARVs ni mwasanga mwina HIV positive.
Okay.
Mkwai. Na mkwata kashishika HIV then twalampena ARVs. Then mwanda tinishi abela free. Ngamwa umfwa ngamwa tumulolekeshe kunu abantu balifuile.
We have really created awareness in most of the health issues surrounding our district. So what we have seen is that a lot of people have been highlighted on a lot of issues. Also, I think we have marketed our services in terms of service delivery. We have seen a lot of what I can say maybe myths and misconception about HIV, which have been clarified. Then we have seen a lot of people on asking a lot of questions, specifically men. I think if you agree with me, it's very rare that you can meet men in health centers or in hospitals unless they are really sick. And in that venue, it's very difficult for you maybe even to have an interaction when they are very sick. So using the local radio through Population Media Center, I think it has helped a lot to have a lot of male involvement. When we look back, HIV, we can say, has been there for quite a long time. But we learned that in terms of knowledge, people are still, they don't have the correct knowledge about HIV. So one, even in terms of transmission, people still feel if I stay with you, I can still get HIV. So those are some of the misconceptions that we have cleared on air, and people have learned that. The other thing that they think when you start getting these ARVs, maybe they will have an effect on your fertility. So they think maybe you cannot have children. So those are some of the things that we have talked about. Then also the issue of PrEP. I think that has been a very contentious issue on PrEP. How do I start getting PrEP? Which when I start getting, then can I stop? So those are some of the things that we have explained, and people have gotten the correct information.
Before nshilamba okutika ku ili ashida Insaka ya Bumi pa radio. Na lemo nakati chachaba hizi ukushita report ili ashida GBV. But after na sound for abantu but mina kosana ku radio. Bashitana complain. Ama afya yo bashingwana naye na mumi kadire yao. Chale sankuseresha. Pona ishibi ati ili ashida GBV. Ili akufisa hao. Ili ashida kuranda pabweru. Techo cheka. Na sasa mbilo kwe bati ila shira GBV shikure na ishwane mwene neka but na sasa mbisha kona beka na mushimanandi so pale no mbefire shitika bakwa shitika ko fedi shira GBV we are doing what is right to raise a report.
At the Buch One Stop Center, I think this is where we receive a lot of SGBV cases, and going forward we've been attending to a lot of GBV cases. What we want to report is that the coming in of Population Media Center, I think, has impacted a lot on us, including our survivors, and making sure that people they got the right information on the SGBV.
My name is Justamvula.
Kokoliko FM, Insaka ya Bumi, hello.
Yes, good morning.
Mr. Simon, good morning.
Insaka ya Bumi has taught me a lot. It has helped me to identify what violence is, how to overcome. I was in love with this gentleman. He was a celebrity, and it was very difficult for me to open up in fear of destroying his name. The reason why I've decided to open up today is because I want to help others and help those who are going through the same. Insaka ya Bumi has really helped me, and after listening to their program, it has taught me to open up and share my story. The counselors of Insaka ya Bumi have made me realize and grow in terms of maturity and handling certain issues.
A lot of our girls, they don't have the right information about what SGBV is, and usually these girls are manipulated and they are defiled. The coming in of Population Media Center has helped a lot, because we've had to give information to the masses at a go. Like when you are at Radio Chengelo, FM and the Flavor FM, that information is automatically given to masses. And that information, I think when people call back, we have had very good feedbacks where we are able to tell that people now are getting the right information.
The onfasa na ma programs ayo mfika ku mulabasa wa Radio Mpongwe apalinga ayalanda pama issues aya health paliko na idia shidia gender based violence. Gender based violence kulaba kuishita abuse ifyo ngatwalanda ati umwaume ashita abuse umwana kashi kuti chabalimbi mukulwa kuti chabalimbi mumirandire kuti chabalimbi mu mimititire okubo mpyalimbi ubukangalume mukulala no mwana kashi.
When Insaka ya Bumi program started on the radio, I personally was very happy and hopeful because I expected that we were going to learn a lot. And for sure, when the program started, different topics have been presented, and one of the topics that I really enjoyed was about family planning and contraceptives. The reason why I was so much interested in the topic is that in Mpongwe here, we have a lot of cases of teenage pregnancies.
The most key barriers were issues of myths and misconceptions in the community. They never used to understand why family planning, when do they have it, what does it do, and what are the effects. So when they listen to the Insaka program, we explain everything about trying to expel those myths and misconceptions. We tell them the benefits of family planning and what they can do to their families.
And there were so many misconceptions and myths concerning contraceptives and family planning. And one of the most popular misconceptions, which I also had, was that contraceptives or family planning was only for married people, because a lot of people, especially youths and adolescents, were thinking that if they use contraceptives before they get married or before they start having children, they will never have children. And so during the program, that myth was clarified, and we've noted that a lot of adolescents and young people are now willing to access contraceptives and family planning.
Previously, before this program came into being, we used to see just women alone coming to access the family planning. But after explanations and teachings that even men are able to access the family planning, this time around we are seeing couples coming, even the men alone coming to access the family planning in our facilities.
My name is Christine Chimbamanga. I'm a registered nurse midwife. I'm an MCH coordinator for Mpongwe district, basically looking after maternal and child health. Surrounding the antenatal care, most women in our setup don't start antenatal booking early. Reason being, they want to wait until the pregnancy starts showing in order for them to go and start antenatal clinics. But that's just because of the needs that they have. Some of them will tell you to say if someone starts early antenatal care, people around them will know that they are pregnant, and then some things will happen. Others would say they will steal their babies and the like, but those are just myths that we need to dispel through the media. Insaka Bumi has really come in handy to help us disseminate information to our communities. The reason being, most of our people didn't have the information that we are giving them now, which has made them better informed, and they are able to make decisions pertaining to their health care. For the children, like child immunization, we have been using Insaka Bumi as well to just encourage women to bring their babies or their children for immunizations or for vaccines when they are due, because most of them would just stay home and say, okay, I delivered, so what next? They wouldn't even try to come if they are not encouraged to come.
Our colleagues, the Population Media Center, came in to boost the area of health education, informing people about the services that we are providing as Ndola District Health Office, obviously through our facilities. So regarding in the area of HIV, family planning, and sexual gender-based violence. For the project, I wish it could continue, because it gives us another platform to interact with the people on the ground.
With this program that has been on air all this time, this has helped improve on the sensitization, and people are aware about their rights and where to report, and we have had a lot of interactions on the air with people who are out there. A lot of concerns are being addressed. We've had experts coming in from all these fields that were mentioned: HIV, AIDS, gender-based violence itself, family planning, just for people to know exactly what they need to understand as regards these aspects of life.
So as we go on, we have been improving the knowledge levels of the community. We actually hope that this program will continue and extend even beyond the period that it has been running.
Following the series of programs we are doing, a lot of people have called. I hope you can even review our programming here in Kitwe, where people have appreciated these services and hope that they can continue. These, from the Kitwe District Health Office side, I must say that population media is bridging the gap that exists in terms of knowledge levels. I just hope that as we progress with these particular programs, the partner also thinks of continuing with such strategies in Kitwe.
As a person who is dealing with creating awareness in the district on health matters, I think so there's need for this program to continue. This program should not be a once-off program, but it should be a program which should be continuous. Each and every time, as we know, change does not come at once. Change is gradual. So people need to be educated on health matters as we have been doing it so that they continue listening to the same program.
We did have people share their stories on HIV, how they used to shun away from taking drugs and all that. But after they listened to Insaka ya Bumi, they would share their experiences on HIV and other stuff.
What this listener did not specify is, did they go to a government or a private health center?
Insaka ya Bumi isn't just a radio show. It's a movement sweeping across the Copper Belt, building awareness, empowering communities, and changing lives. We knew that to make this show a household name, we had to go beyond the airwaves and meet our audience where they already are, online and in their social spaces. We enlisted the voices of top Copper Belt influencers, people the community knows and trusts. These influencers, each with a powerful following, spoke passionately and about issues close to the heart of Insaka ya Bumi: HIV/AIDS, family planning, SGBV, and maternal health. They shared these messages across their platforms and ours on Facebook, YouTube, and LinkedIn, instantly amplifying our reach. Then we took it a step further, creating a 4-part reel series with skits acted out by these influencers, relatable, relevant, and accessible. These videos appeared on the most popular platforms in the region, YouTube and Facebook. Through these creative story-driven reels, our audience saw their own experiences and challenges reflected back to them, building a powerful sense of connection and understanding. But we didn't stop there. To make sure no one missed out on the insight from the show, we placed programmatic ads that directed viewers straight to the episodes uploaded on YouTube. In just 3 months, these ads reached more than 2.6 million people, capturing the attention of the intended audience and keeping the conversations alive far beyond the radio waves. Through engaging content, influential voices, and strategic outreach, Insaka ya Bumi is making airwaves on the Copper Belt, creating a legacy of knowledge, connection, and action that lasts far beyond each broadcast.
My name is Charles Kalonga. I'm the Country Director for Population Media Center, a global non-for-profit organization that uses entertainment, education strategies to address various health and social issues. During the 6 months of implementing Insaka ya Bumi, we've received positive feedback from the target audiences. We received positive feedback from our main stakeholder, Ministry of Health. We've also received feedback from the radio stations themselves. The impact that Insaka ya Bumi has had on the Copper Belt communities is evident that this project should be scaled up within Copper Belt and beyond. And PMC is a great partner that would help improve the health outcome of Zambians on the Copper Belt and beyond, with the resources being available.
Help us keep this lifeline on the airwaves. Together, we can ensure that the voice of hope, knowledge, and change continue to echo across Zambia.